All right, congratulations. You're 1 week after surgery. Hi, I'm Dr. Ortiz.
And I'm Dr. Arturo Martinez.
All right, cool. So we're going to walk you through the different steps and probably important stuff you need to know right here after 7 days of surgery. Go ahead, hit it.
Now, first of all, I just wanted to mention that our main focus at 1 week out is the oral intake. You have to be well hydrated, and for this you at least need around 32 ounces of fluid on a daily basis. 32 ounces is 1 liter, or to put it in layman terms, about 4 cups of water, or 4 cups of any fluid for that matter. If you cannot have this precise amount or not even close to this amount, you really need to contact us because we can give you some strategies as to how to improve your oral intake.
All right, it's extremely important to keep hydrated, not any liquid because tequila doesn't count right now.
Of course not. The main liquid you should be having at this point is your protein shakes, but remember you can also mix in some other liquids such as Pedialyte, Gatorade, clear fluids of any kind, but also stay focused on the amount of protein that you need on a daily basis.
So you're still fresh out of the surgery, so 7 days after surgery there could be things that require medical attention, though it's very rare. Most of the times they're usually associated to poor tolerance to liquids. Sometimes there's inflammation, a little bit swelling going on, intolerance to certain liquids, even gastritis. I mean, the inflammation, the stress of having surgery produces more acid, and that in turn can close up that procedure you had, whatever procedure you had. So weight loss surgery can have these issues at 7 days. If you have intolerance to liquids, you're throwing up, it's not going down, you're feeling dehydrated, abdominal pain, if you're feeling extreme weakness, if it's not getting better, if it's getting worse, you need attention immediately, and of course, let us know.
I do want to add the fact that if you don't prevent any of those issues, I mean, they can happen, your complications can happen at any moment if you're not vigilant and preventive. What I mean by this is that you have to keep active with your breathing exercises. You also have to walk around. If you stay in bed all day, this can lead to complications, but this is why you should be focusing on prevention. Walk, stay well hydrated, and keep doing your breathing exercises with the inspirometer, especially if you can't quite get that full breath of air. Keep active with it.
So basically you're saying keep yourself moving. You've had surgery, but doesn't mean you have to be bed rest.
Of course.
3 days. After 3 days, it's important you start off with your normal activities. If you're in doubt, just give us a call to this number below. You know the number with that little medical attention card we gave you. So activity is extremely important, like Dr. Martinez says. And most importantly, it's like get back to your normal activities, except the eating part, be gradual about that. I don't know if we want to add something else.
Well, the other thing that we can talk about is common complaints at this point. Some people still complain about incisional discomfort, and it's pretty normal because you're still a very short time out from the procedure. If you need to take something other than the medications that were prescribed to you, you can also add over-the-counter painkillers that may help. But remember that this is going to be something that will gradually tend to disappear. The other thing is constipation. If you have not had a bowel movement at this point, you can also take a laxative. The most common laxative that we use is milk and magnesia because over the years we found out that this is the only one that doesn't lead to a lot of cramping or a lot of pain. Just get that one-time response, and as you increase the amount of fluid that you're intaking, this will tend to happen less. Also remember that since you're not eating solid food, you're not going to have a bowel movement every day or every 2 days. Once you increase the amount or the consistency of food, and you can also add some fiber to this, you're going to see that you become a little bit more regular. But people don't get regular until they're on a solid food diet.
All right, and lastly, medications. We prescribe certain medications. Usually you can wean off them almost immediately. It's been given to you in the written script we gave you. But also, if you have difficulty with them, go ahead and suspend them and immediately let us know and let your local practitioner know. Now, the medications you are on, go ahead and 2 things. Keep on taking them, but immediately go and follow up with your healthcare practitioner because it's extremely important. The requirements are going to change. Diabetic, hypertension, cholesterol, these types of medications during the first 2 to 3 months, sometimes even weeks after the surgical procedure, your requirements may become less. They might even disappear. You might not need these medications anymore. So be wary about that. And again, when in doubt, give us a call. We're always here.